Hello, welcome to any community. In this particular video, we are going to discuss Nayana or Netra as Bahya Srotas. Ayurveda says 9 different Bahya Srotas in males and 3 extra Srotas in females. In the last video, we have discussed the Asya or mouth as main Bahya Srotas. In this particular video, we are going to discuss the next set of the Srotas, that is what we can say Nayana or eyes. When you think about the Nayana, it is one of the important Indriya, Jnanendriya. They are 2 in number. They are considered to be Bahya Srotas, which is present in Urdhvanga Bhaga, that is head and neck region of the human body. This is actually responsible for the Darshana Jnana, what we can say, or Rupa Jnana, or we are going to visualize the objects. As far as the dosha are concerned, specifically Alochaka Pitta and Tarpaka Kapha are located in this particular organ. If any kind of the disturbances are occurring, there may be a possibility of affliction of these either Alochaka Pitta or Tarpaka Kapha. As far as the Netra Sharira are concerned, Ayurveda has discussed some of the important Sharira Avayava specifically related to eye. Mandalani cha sandhimshcha patalani cha lochane yathakramam vijaniyat pancha shat shad evacha. Mandalani, they are 5 in number. Sandhi, they are 6 in number. And Patala, they are 6 in number. When you think about the mandala, so this is what we can say the cursor is moving, what we can say that is considered to be Pakshma Mandala. And just beneath that, what we can see, the eyelids are there. They are considered to be Vartma Mandala. And the eye, white of the eye, that is being termed as the Shweta Mandala. And dark of the eye, that is inside the eye, what we can say that is considered to be Krishna Mandala. And further, the darker black circle, which is being present inside this particular dark circle, is being termed as Drishti Mandala. Like that, 5 mandalas are there. As far as 6 Sandhi are concerned, the joint between the Pakshma and Vartma, that is the eyelids and eyelashes, that is being termed as Pakshma Vartma Gata Sandhi. And the one which is present in between the Vartma and Shukla, that is the Shukla Gata, that is the white of the eye, that is being termed as Vartma Shukla Gata Sandhi. And this is the one that is being termed as Shukla Krishna Gata Sandhi. And this is being termed as Krishna Drishti Gata Sandhi. And the one which is present nearer the medial canthus, what we can say, this is termed as the Kaninika Sandhi. And the one which is present on the other side, that is being termed as Apanga Sandhi. So like that, there are the 6 Sandhi are there, whereas 6 Patala are there. Among them, 2 are considered to be Vartma Patala, one in the above and one in the below. And 4 are considered to be the related to the Dhatu level. And as far as the certain other measurements, It is having the 2 angular depth and it is having 2.5 angular diameter. This is about the description in brief related to Netra Sharira, or what we can say the Ayurveda Netra Sharira. As far as anatomy and physiology of eye are concerned, this is the overall the depiction cross section of the eye, which is consisting of these 3 layers. Outer one, that is sclera, then comes the choroid, and later that is considered to be retina. And on the anterior side, that is the transparent layer is there, which is actually having the continuation with the sclera, that is being termed as cornea. And outside the cornea, there is the epithelium will be covering, protecting the eye, that is being termed as conjunctiva. And in between, inside this particular cornea, we are going to see what we can say the dark color of the eye, that is being termed as iris. This is actually responsible for the constriction and dilatation of the pupil. Pupil is nothing but the aperture present in between the iris. And the just behind, posterior to the iris, that is being considered to be lens, which is being supported by the ligaments. And the anterior to the lens, that is being termed as aqueous humor, and posterior to the lens, that is being termed as vitreous humor. And the later, this is considered to be what we can say the optic nerve, which is being emerging from the eye. This is about the brief anatomy. As far as brief physiology is concerned, sclera gives the protection to the eye, whereas cornea, that is actually responsible for the refraction of the rays, light rays, going to take place from the exterior to the eye, whereas conjunctiva protects the eyeball anteriorly, whereas the one which is being present on the this one iris behind the cornea, which is actually responsible for the dilatation and constriction of the pupil, which may range from either 2 mm to maximum 8 mm. The movement of the pupil diameter will be possible. Further, this is considered to be lens. Lens also is responsible for what we can say the refraction of the light rays, which in turn results in the falling of all these light rays into the retina for the formation of proper images. Here, the aqueous humor, which is present in the anterior part of the anterior to the lens, that is actually the concentration or the quantity that will vary depending upon the secretions that is going to take place from the choroid process, which is being present, which is the continuation of a ciliary process, which is the continuation of choroid. Whereas vitreous humor, which is a constant liquid, which will not have any kind of the changes in the quantity. This is what we can say about the brief physiology, functional anatomy as well as physiology of the eye in brief are concerned. As far as Samanya Netra Roga Nidana, which are the possible causes of what do you say that the eye diseases where eye can become afflicted are mentioned in Sushruta Samhita. उष्णाभितप्तस्य जलप्रवेशात् दूरक्षणात् स्वप्नविपर्याच्च प्रसक्तसंरोधनशोककोप क्लेशाभिघातात् अतिमैथुनाच्च शुक्तारणालां kulathamasha nishevanad vegaminigrahacha svedad rajo dhuma nishevanacha chardehe vighatat vamanati yogat bashpagrahat sukshma nirikshanacha netre vikaran janayanti dosha. Because of all these reasons, the person will be having the affliction of the eye. Ushna abhitaptasya jalapraveshat दूरे क्षणात् स्वप्न विपर्ययात् च प्रसक्त संरोदन शोक कोप क्लेश अभिघातात् अतिमैथुनात् च शुद्ध आरनाल अम्ल कुलत्थ माश निषेवणात् वेग विनिग्रहात् च स्वेदात् रजो धूम निषेवणात् च छर्देः विघातात् वमन अतियोगात् बाष्पग्रहात् सूक्ष्म निरीक्षणाच्च नेत्रे विकारान् जनयन्ति दोषाः. If you split this, this will be like this. Ushnabhitaptasya jalapraveshat. When the person is coming through the bright sunlight, very hot, humid atmosphere, if he is going to take the bath or if he is doing the swimming soon, there may be a possibility of eye affliction. So that means the person may have intraocular hemorrhages are possible because of a sudden, or do you say that the burst of the capillaries may be possible inside the eyes. Durekshanat, visualizing the far objects frequently. Farther objects frequently. We are going to constrict the eyes so that we are going to visualize the far away things. Swapna viparyayatatcha. If the person is sleeping at irregular time, he may be having the burning in the eyes, or he may be having the sleepiness, etc. Or he may have sometimes itching around the eyes may be possible in cases of swapna viparyaya as such. Prasakta samrodana, continuous crying. So that is leading to the lacrimal secretions going to get dried up. Thereby, there may be a possibility of the eye disturbances may be possible because of the, what do you say, that the dry eye syndrome may be possible. Shoka, which is having the similar to that of the crying, samrodana. Kopa, anger, which is actually responsible for the activation of sympathetic nerve stimulation. We are going to discuss this particular context of the autonomic nerve stimulation in terms of the Maithuna in the next coming slides as such. And klesha, any kind of the mental stress as such, the person may have the eye disturbances. Abhighatat, trauma to the eyes. Atimaithunacha, excessive sexual intercourse or excessive coitus or copulation may lead to eye diseases. Shupta aranala, these are the intoxicated substances. Amla, sour substances. Kulatha, horse gram. Masha, black gram items. Vega vinigrahacha, suppression of the natural urges. Svedat, excessive sweating or fermentation. Rajodhuma nishevana, that means exposure to dust or smoke. Chardehe vighata, suppressing the vomiting, or otherwise the vamanati yoga, the person is having the excessive vomiting. That means if you are administering or emesis therapy frequently. Bashpagrahat, suppressing the tears. Sukshma nirikshanacha, that is the visualizing the very minutest things. So where we are going to again constrict the pupils as such. If the persons are indulging in these kinds of the activities, they are the frequent sufferers of Netra Vikara. Now, we are going to discuss what is the rationale behind Maithuna and Netra Vikara. Whenever there is the Maithuna is happening or excessive copulation occurs, coitus occurs, there will be the activation of autonomic nervous system. So this particular the table discusses about the impact of the autonomic nervous system on the eyes and reproductive organs. When you think about the pupil, sympathetic nerve stimulation will be responsible for the dilatation of the pupil, whereas parasympathetic nerve stimulation will be responsible for constriction of the pupil. Ciliary muscles, they are responsible for the slight relaxation of the ciliary muscles, whereas in case of the parasympathetic nerve stimulation, that will be responsible for the constriction of the muscles, ciliary muscles. Lacrimal glands, this will be responsible for the reduced tear formation or lacrimal secretions, whereas parasympathetic nerve stimulation is responsible for the increased lacrimal secretions. On the penis, sympathetic nerve stimulation is responsible for the ejaculation, whereas parasympathetic nerve stimulation is responsible for the erection. Whereas the vaginal area, sympathetic nerve stimulation may lead to the dryness of the vaginal mucosa, whereas parasympathetic nerve stimulation may lead to excessive secretions or mucus secretion may be possible, which actually facilitates the friction of the genitals. This is what we can say the impact of autonomic nervous system. When you think about the physiology behind it, limbic system, which is a part of the base of the brain, is considered to be responsible for the controlling the emotions, even including the emotions occurring in the fetus also. So when there is a sympathetic nerve stimulation during the coitus act, that will be responsible for the sympathetic nerve stimulation, which again is responsible for the increase of arterial pressure or increased heart rate, etc. So that means it will be having an impact on the all over the body. So that means there will be a possibility of reduced secretions to take place in the alimentary canal, etc. So that also responsible for the reduced secretion to happen in the lacrimal glands also. Further, which will be leading to reduced tear, thereby the person may have the dryness of the eye may occur. Plus, we are knowing the ciliary muscles activity. When the person is doing the excessive sexual activity, that will be responsible for the activation of ciliary muscles also, which again is responsible for the slight relaxation to happen in the ciliary muscles, which may alter the aqueous humor formation. So there may be a possibility of increased secretion may take place, which may lead to the increased intraocular pressure. So probably this may be the reason we can able to hypothesize that this may be the one of the reason for the development of what we can say glaucoma. In this way, frequent sexual activity may have an impact on the disturbances of the eye. When you think about the Chakrat Graha, one more example, let us say how this is constipation may lead to Netra Vikara. So it is being mentioned that the person is doing the either suppression of the natural urges, specifically defecation. So that will be responsible for what you say that the absorption of the what you say that the water portion, nearly around 75% of the water is present in the fecal matter that is going to get absorbed. Further, the person will be having the constipation, in the sense the person will be having the apanavata vikriti. When there is apanavata vikriti, there may be a possibility of a samanavata vikriti due to the pratiloma pravritti of apanavata. Further, There may be a possibility of pratiloma pravritti of pranavata also. So, and it is being mentioned that pranavata is considered to be responsible for the controlling the functions of the indriyas, etc. So, like that, in that way, this may lead to the indirect affliction of the Netra Roga as such. And it is being mentioned that in the Western physiology, etc., the constipation may have an impact on the uh, bacterial growth in the colon. So that means which will be leading to the dry eye syndrome as such. So the reference is being mentioned in this particular slide itself. As far as significance of the Netra are concerned, it is considered to be one of the major natural orifice which is actually helping in the proper vision as such. When the person is exposed to dust, smoke, and when the person is having any kind of the nasal infection which is leading to the lacrimal sac obstruction, thereby there may be a possibility of the movement of the reverse movement of the lacrimal secretions, and use of the clothes, infected clothes, but to the eyes, etc., they may actually have the affliction related to eyes as such. Whereas the symptoms may be observed in such occasions could be there may be a possibility of itching, there may be a possibility of redness, lacrimation, that is increased lacrimal secretions, burning sensation in the eyes, or pus discharge from the eyes may happen, pain or vision disturbances may be possible, or sometimes even the swelling of the eyes may also be possible. In this particular occasion, there may be a possibility of either interstitial compartment or intracellular compartment of the human body may be afflicted. Improper anjana, improper tarpana, anjana in the sense the application of these medicaments into the eyes, such as kajal, etc. What we the or otherwise tarpana, that is the keeping the warm ghrita to the eye. If that is not properly being done, there may be a possibility of dysfunction related to eye. In that particular situation, there may be a possibility of itching or redness or lacrimation, etc. that may be possible. So Ayurveda, Sushruta says, Tatravilam sasamrambham ashtakandupadayavat Gurushadodaragadyayi jishtam cha avyakta lakshanai. These are the Pura Rupa may be observed in case of eye affliction. That is Tatravilam. There will be a possibility of turbidity in the eyes as such. Sasamrambham, discomfort will be observed in the eye. Ashru, lacrimation may be possible. Kandu, itching will be there. Upadehavad, kind of the secretions may be observed. Sometimes the closing of the eyes may be possible. Guru, heaviness of the eye may be indicative of kapha dosha dominance. Usha, that is Osha, that means they responsible for the burning sensation, that is indicative of pitta dosha dominance. Toda, that is indicative of the pricking sensation, vata dosha dominance. Raga, redness, pitta dosha dominance. These are the pura rupa, they are going to get observed in that particular situation. Sashulam vartmako visheshu shukapurnabhamevacha. These are the lakshana that we are going to observe. That is Sashulam, pricking sensation will be observed. Vartmakosheshu, in the eyelids will be present. Shukapurnabhamevacha, as if the shuka, that means pointed objects such as paddy, etc., that particular type of the feeling, as if they are pricking to the eyes, that will be observed. Vihanyamane rupeva, the person will be having the abnormal vision as such. So like that, these are the lakshana that we are going to observe in this particular situation. The take-home messages from today's discussion are: Nayana is considered to be a very important Bahya Srotas, which is actually helpful in the vision and other assisted function. And improper Anjana or Tarpana, etc., or otherwise Ushnavitaptasya Jalapraveshad, etc., that will be leading to the dysfunction related to eye. If the person is having the disturbances in the eye without the involvement of the amashaya or stomach, etc., then we are going to say there may be a possibility of intracellular compartment of the eye can be afflicted. If involvement of the stomach or small intestine or large intestine is being observed, then in that particular situation, there may be the initial affliction of gastrointestinal tract compartment, which in turn leads to intravascular compartment affliction. Later, there may be a possibility of interstitial compartment of the eye may be afflicted, and at last, there may be a possibility of intracellular compartment of the eye can be affected. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.